Thank you and good morning, everyone. I'd like to begin by paying my respects to the Torres and Jagera peoples on whose land this conference is, of course, being held. I would also like to acknowledge the Dja Dja Wurrung peoples on whose land I'm fortunate to live and work on, and pay my respects to elders past, present, and to future emerging generations for whom our collective work is so important, and to acknowledge the long history of our people's sophisticated holistic knowledge systems that have informed our historic and ongoing roles as custodians caring for country. I am a proud Narungagana woman and the CEO of the Lowitja Institute, Australia's National Institute for Aboriginal and Torres Strait Islander community-controlled health research. Can I say how pleased I am to come together with a group like yourselves, people whom are committed to working towards, net zero emissions, climate resilience, and an equitable and an environmentally sustainable healthcare sector that is ensuring good health for all. That tells me that you are committed to doing the hard work that is involved in changing entrenched systems that normalise inequity. It tells me that you have some sense of what it means to be doing the work and the hard work to transform dominant culture. Those challenges are something I know only too well through my work to embed cultural safety across the health system and to impact racism. And it tells me that you understand the importance of the holistic understandings of health, and that our health and well-being are directly related to the health of our country. This is something that my people have known for tens of thousands of years, and that contemporary health sector is now, getting up to speed with, beginning to grasp through concepts such as environmental determinants of health and planetary health. So today I'd like to speak to you about some of the much needed research we've taken or undertaken on climate change and our health. And this could not have been achieved without the Climate and Health Alliance, who have been fantastic allies for us in doing this work. They helped us navigate systems and open doors for us that otherwise might not have been opened, and of course that we benefited from, like being able to participate in the side event at COP26. And I encourage you that if you're working for a more sustainable and equitable healthcare sector, that you take some lessons, a feather out of the cap from the allyship that we've experienced with CAHA. This slide shows you our climate change and Aboriginal Torres Strait Islander health discussion paper. It was prepared for the Lowitja Institute and the National Health Leadership Forum by the HEAL Network, the CRE Stride, CAHA, and we particularly want to thank Dr Veronica Matthews for leading this work for us. You can find the report at that Lowitja Institute site address there on the slide. Please download it, read it, and share it with your colleagues and networks. Include it in your newspapers, feature it in your journal clubs, and I encourage people to engage deeply with its messages and its calls to action. I was really very proud to officially launch our report at the side event meeting that I aforementioned at COP26. Following its, pre-discussions at a virtual roundtable meeting just last month, and you can see the tweets from that from the side event there on the slide. We've seen incredible leadership shown by many Indigenous peoples globally through their activism and their contributions to COP26. It was also fantastic, awesome, deadly to see many young Indigenous peoples advocating in Glasgow. And it reminded me personally of a wonderful quote from the 2021 Close the Gap report, which Lowitja Institute wrote and can also be found on our website. It covered the exceptional legacy and leadership roles of Indigenous people in the face of multiple crises, including the growing toll of climate change. The quote that really does stick out in my mind is from the Seed Mob Youth Climate Movement, who declared in our report, all around the world, sea levels are rising, and so are First Nations people. For the Lowitja Institute, our journey to this contribution to climate action began in developing our strategic plan, acknowledging that climate change was a policy area that absolutely needed immediate attention when it came to the health and well-being of our peoples. The report highlights the disproportionate effects of the climate crisis upon our people. We heard from them directly at our roundtable last month when we heard from an elder from Tennant Creek in Central Australia, Mr. Norman Japaruwala, who described how extreme heat was affecting the health and well-being of himself, his community, and of course, his country. He told us that when he went away for dialysis, which is obviously he did on a regular basis, he returned to find his power off because of extreme heat. His food was spoilt, and it was a long way to go and get food. And of course, food is very expensive in this region, and his medicines were unable to be kept cool and safe. And so therefore they're unusable. And of course, in some instances, that's life-threatening. The Journal of Pediatrics and Child Health has recently published an article by himself and his Dr. Simon Quilty, which addresses many ways that heat and changing climate are harming our cultures, our peoples, and our countries. In the article, Mr. Japaruwala says these words on the slide. I'll just give you a moment to read those words. You can see through those words the impact that perhaps we don't think about. And the concerns he expressed here are widely shared by Aboriginal Torres Strait Islander communities across the country. Our report shows that climate change is compounding historical injustices and disrupting cultural and spiritual connections to country that are central to our health and well-being and our cultural determinants of health. It also highlights that our health services really are struggling to operate in extreme weather with increasing demands and a reduced workforce. All these forces combine to exacerbate already unacceptable levels of ill health within Aboriginal Torres Strait Islander populations. And here I want to highlight strengths-based discourse, and Lowitja has done some work on, the negative narrative that surrounds Aboriginal Torres Strait Islander health, and that we should not be seen as a vulnerable population, but as a priority population, which really is important to changing the narrative and the focus on the issue, with the issue being the system, not Aboriginal Torres Strait Islander peoples, and how that system affects us and therefore where we should be, which is a priority. Yet, despite being a priority or a vulnerable population, whichever place you want to place us in, to date, we've not been sufficiently included in national conversations about climate change. And environmental health determinants have largely been absent from the national narrative around, national Aboriginal Torres Strait Islander health policies. There are gaps in research, gaps in data, and most reporting on climate change does not include our voices or our local knowledge. Many solutions are known, amongst Aboriginal Torres Strait Islander peoples, but there is not equal or equitable access to them. And this report finds importantly that these issues are inevitably linked to structural and systemic racism. As many of you know, prior to colonisation, Australia consisted of more than 250 nations representing a broad diversity of cultures and knowledges. Central to all of our cultures is an understanding of the holistic nature of health and well-being. That good health is dependent on respectful and reciprocal relationships to country, culture, spirituality, community, and family. For at least 65,000 years, we've developed a unique connection and equilibrium with land, seas, and environments in which we live. We took our role as custodians of country very seriously. But colonisation severely disrupted and devastated these connections and our custodianship of our lands. As Maori scholar Dr. Rhys Jones says, from an Indigenous health perspective, climate change can be seen as an intensification of colonisation. Colonisation ignored Indigenous ways of knowing, being, and doing, right down to the weather, insisting that we live according to just 4 seasons, brought here from England, of course, instead of the many seasons our people knew and respected locally. We even had our weather colonised, and in doing so, it threatens to make this country uninhabitable. Ironically, terra nullius, yet again. So if we're honest about truth-telling needed in our country, we must be honest about what made countries sick in the first place. But this This challenge brings the opportunity as well, and it brings strength. Climate change presents an opportunity to redress and empowerment of our communities to lead climate action based on our intimate knowledge of country. And that's why the Lowitja Institute and the NHLF is working with CAHA to spread the word on our discussion paper and its recommendations so that it can have meaningful impact on policy and health outcomes through knowledge translation, which is at the heart of Lowitja Institute's work. We don't just do research for research's sake, we do it for our community and we do it for impact. Our paper maps out clear calls for right-based climate action and place-based adaptation and mitigation. Its 4 high-level calls are the following. 1, take action that respects human rights and achieves equitable health and environmental outcomes for Indigenous peoples. 2, value and centre our knowledges and rights as Aboriginal Torres Strait Islander peoples. We've protected country for millennia and have survived dramatic climatic shifts. Remember, we were here when Australia had its last ice age, and we've survived that. And we are intimately connected to country, and our knowledges and cultural practices hold solutions to the climate crisis. 3, work with us to protect country and do the work on adaptation and mitigation planning. We need equitable access to housing, renewable energy solutions, and our lands and our waters. We need access to that, and a united effort to stop the government ripping every mineral out of the ground. 4, last but not least, create a movement for climate justice. Climate change will affect us all, but some of us more than others. We need to ensure climate action learns from historical truth-telling and commits to not repeating the wrongs of the past. This is climate justice, and it's deeply linked to race relations in Australia. We are the only first world nation with a colonial history whose constitution does not recognise its First Peoples. The current federal government dismissed what was offered by Aboriginal Torres Strait Islander peoples as a gift to the nation, the Uluru Statement from the Heart. The statement calls for voice treaty truth. In my view, you cannot be taking serious action on climate unless you are acting on self-determination and climate justice. I would love to see each and every one of you at this conference and your organisations and networks to commit to supporting the Uluru Statement from the Heart, integrating its calls to action into your work and putting climate justice at the heart of your work going forward in building a sustainable, equitable healthcare systems. As we work for transformative change so that our health systems are equitable, climate resilient, sustainable and net zero, I want to highlight the work that Aboriginal Torres Strait Islander people and organisations have done to embed cultural safety into the health systems as a blueprint that I offer you for change and a possible learning for greening our healthcare sector. First, let me talk about what cultural safety means and how it's crucial to transforming the healthcare sector to achieve equity for Aboriginal Torres Strait Islander peoples. I believe it's foundational for any policy that we want to embed into our sector. And then I'll outline our efforts to embed cultural safety in healthcare and how that can show the way forward for us on transformative climate action in and out of the healthcare system. In Australia, we tend to use the words cultural safety and cultural awareness almost interchangeably, but they are different. Cultural awareness is focused on improving the knowledge of non-Indigenous Australians. It others us as Indigenous peoples by examining our cultures, the way we live our lives, if you like. It's a process of looking at us, so the gaze is outwards. Non-Indigenous peoples don't have to examine themselves. This is often, of course, then a comfortable experience for non-Indigenous peoples. Cultural awareness can also sometimes reinforce the simplistic notion that all Aboriginal Torres Strait Islander peoples are the same. So we can have cookie cutter approaches, broad brushstroke approaches to policy, but we're not the same. And we can see this from Tyndale's map. We are uniquely and beautifully different. And you can never know all there is to know about us. There is no tick list on how to treat us. With cultural safety, however, the gaze is inwards. It's about critical self-reflection, tuning into our racial orators. It's about examining racism, really understanding it. When learning about cultural safety, non-Indigenous peoples are asked to critically examine themselves, their own worldviews, their assumptions and their beliefs. So the gaze is inwards. They come to recognise how these ideas, attitudes and beliefs are formed intergenerationally, the social soup that we live in and we swim in. And it's embedded into our organisations and our systems, into our very structures. Cultural safety asks the non-Indigenous peoples to acknowledge how these views, these assumptions, these beliefs may be harmful to their non-Indigenous colleagues, and then to challenge them, to see what they haven't seen before and then learn them. Cultural safety unpacks the concept of dominant culture, and I can't fully unpack this slide here, but when you're a member, essentially, of dominant culture, your identity is constantly affirmed and reinforced in ways that you possibly don't even realise, because the structures that are formed and built around you are created by your culture. But for those of us living outside of dominant culture, it can be challenging. As this slide says, and this is my nutshell moment about dominant culture, it's important to acknowledge that when non-Indigenous peoples arrived here, they redefined what was normal and redefined all of the things that, we had to live by. Before I was given the privilege of leading the Lowitja Institute, I was the CEO of the Congress of Aboriginal Torres Strait Islander Nurses and Midwives, or CAHA, an amazing organisation. And I was pleased while at CAHA to work closely with APRA and many other stakeholders to launch a new Aboriginal Torres Strait Islander health and cultural safety strategy. It recognises that cultural safety is a critical component of patient safety. The strategy sets some clear direction and a course of action for APRA and the national boards and accreditations authorities who, of course, regulate Australia's health practitioners through. And that all of this is based on legislation. So we were really determined, to affect and embed that legislation with cultural safety. We also worked with peak bodies for nursing and midwifery to embed cultural safety into the new nursing and midwifery codes of conduct, our education accreditation standards, and then to health service standards through the Health Care Safety and Quality Commission. But we faced hysterical and ill-informed reactions. Some of them you can see on the slide here. They were fired up by elements of the media, something that I'm sure all of you seeking climate action will know about only too well, how you can experience backlash from media. But amid that backlash, it made such a difference for us that the nursing and midwifery leadership were solid in their support for cultural safety. And it made a difference that many of these leaders had done cultural safety training and a lot of critical self-reflection. So these non-Indigenous women and men understood about their power and their privilege, and that it wasn't the work of Indigenous nurses to counter the backlash and unpack racism and explain cultural safety. It was their work. Cultural safety is an approach that understands that equity and equality, are different. Equity is required first for equality to be the outcome. And I think this slide explains that beautifully. Equality usually focuses on people getting the same experiences and opportunities to affect the same outcome. This is what, people mean when they say, I treat everyone the same, usually in the name of fairness. But as we know, that can only work if everyone starts from the same place and needs the same help. In contrast, equity is understanding that people come from different experiences, and we need to meet people where they are at and give people what they need to be successful. This is both critical, I believe, in healthcare and in climate action. And the growing focus on cultural safety is now evident in the position taken by many national Aboriginal Torres Strait Islander health organisations over the last decade. Almost all of them have policy and position statements and frameworks that address racism and cultural safety. Cultural safety has started to gain traction in mainstream, health organisations at a national level too. But words must be translated into action, and here is where allies come in. Allyship and understanding allyship and cultural safety is a lifelong journey, but I encourage you to start that journey today. Aboriginal Torres Strait Islander peoples represent 3% of the population of Australia's total population. Just imagine for a moment what could be possible if the 97% of other Australians were allies in addressing racism, promoting equity, valuing culture and country, creating cultural safety and acting to address climate change, particularly in their workplaces. We need multiple voices working together on the same page, but we need governance at all levels that privilege Indigenous leadership, and not just putting one Aboriginal person on a reference group, not just adding a paragraph to a climate strategy about the impact on Aboriginal Torres Strait Islander peoples. And that's why CAHA's done this amazing work with us. We need authentic involvement, and we need knowledge translation. Like we saw with cultural safety, perhaps we could develop accreditation standards for climate action and a low carbon health system, so that action is hardwired into systems and not dependent on individuals. And individuals leave and go, but if we hardwire it into system, it remains there and enduring. And then that these standards are acted upon, and then they're measured and reported upon. And hopefully this happens publicly. We need to do that at every level. There are opportunities to embed climate action accreditation standards, from RACGP and ACRIM accreditation standards through to the Minister Hunt's office. But we could even embed it in our education systems as well. We have, whole university systems that have accreditation scaffolding around them. Like with cultural safety, if you embed change, it's long lasting. Otherwise, it's just more ticking boxes. And like, in anti-racism work, people may think they're doing great work to little or no effect until they measure it. And we would all benefit with some good examples if we were to do this work. Case studies of how to do well, communities of practice to show how these accreditation standards can work. And this is, all of this scaffolded around these accreditation standards can lead us, to doing this work well. And we don't know what we don't know, and what is exemplar, without dreaming and coming together through, communities of practice to think about what that looks like. And of course, we need to develop a climate and health workforce to support the work. And of course, assessors of these accreditation standards that know this work. And of course, we need to privilege the voices and expertise of Aboriginal Torres Strait Islander peoples and organisations. On that note, can I finish by inviting you to one of our signature Lowitja events, which is happening next year, a knowledge translation event to further spread the word on our climate change and Aboriginal Torres Strait Islander health discussion paper or our report, to ensure our recommendations are widely taken up. And I look forward to seeing you all there, and thank you so much for this invitation to join you this morning. Have a fantastic day. Thank you.